Hi everyone, I'm Christy from Robbins Rehabilitation East. I'm a physical therapy here in our Phillipsburg office. I like to focus on pain neuroscience. It's one of my favorite things to talk about and study and apply to patient care. So I wanted to come to you today, review one of our prior videos and see how we can apply that to how it applies to the injuries that you might feel on a day-to-day basis. What we spoke about last time is something called the protectometer. So this helps us gauge how many stressors you might have in your life that influence your symptoms and how many good things might help to counterbalance that. Those categories are things you hear, see, smell, taste, and touch, things you say, places you go, things happening in your body, things you do, things you think and believe, and people in your life. So on the danger side, fill that out with any information that you might have. On the safety side, it's the same categories, but we're looking for things that influence you in a positive way. For instance, it could be things you do, you exercise, you go to physical therapy, you follow up with doctors, you like to go out for walks. On the danger side for that same category, it could be you sit all day at work, or you might smoke, or you don't exercise. So we want to create a list here. What we can do from there, we'll get back to in just a minute. But I'm going to take a step back and talk a little bit about how your body responds to an injury and then how this applies. So first, prior to an injury, we've got kind of two mountains here. This first mountain here, this is your tissue quality. So here we have your tissue tolerance. That's when you start to get a breakdown of your tissues. You might get muscle soreness, you might even start to tear things. Here it takes like a superhuman effort, so most people don't really go there. What we have here is protect by pain. So pain is meant to protect us and not actually tell us about the quality of our tissues or if there's actual damage that has happened. It does alert you that damage may be happening, but it doesn't always correlate. So what happens is we'll be doing an activity and you might start to get pain, but it's telling you that you maybe should stop depending on the situation, or that it's just not comfortable being there. And usually that's before you get to any tissue damage. Once you have an injury though, what happens is these two lines, they lower. So your tissue tolerance has now come here. So this is your new tissue tolerance. And then your protect by pain comes way down here. So the alarms start to go off much, much sooner. So instead of all the way up here, it's going to take less to aggravate the tissues that might be influenced than it did previously after your injury. And that's because it wants to help protect you from getting hurt again, even if there's no real threat. Now going back to the list, the more things you have on that danger side, we think of it like a backpack. If you're climbing up the mountain and you have that big backpack on, the more things on that danger side, it's filling up that backpack. Things on the safety side take objects out of that backpack. So when you're climbing that mountain and you're trying to get better, we want to have as much out of that as possible. Because think about carrying that heavy backpack up a steep mountain as you're trying to get better. It doesn't help at all. So we work towards getting that balance, creating more safeties for you, seeing how you can manage some of the dangers that you might have, but it's something to keep in mind as you are trying to get better and heal from any injury, whether it's an ankle sprain to chronic pain, fibromyalgias, any neurological issues as well. But take a look at the different factors that are influencing you. Know that after you have an injury, your body might be giving you some mixed signals just because it means to protect you. For instance, it would be like if you didn't have spotlights on your house and then you get broken into and then all of a sudden you put spotlights on, but a cat's coming by, the lights are going to go off, and that would be like your body setting off an alarm saying that it's not quite comfortable with what you're doing and it wants you to stop. Then our goal when you come to physical therapy is to start to challenge it and retrain it to know that it's safe. The more we touch on this lower protect by pain line, it starts to get used to it, and then it starts to raise up, and then we have a new level, and then it'll raise up higher and higher so you can get back to a better quality of life. Thank you.